Hi everyone. Sorry about my delay. Things are a little hectic around here. Hello, good to see you on this Wednesday, July 18th. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Here to give you some updates on COVID-19 pandemic. It's hard for me to think that it can get any worse. So today we are reporting on the cumulative number of cases, 47,222. 547 cases were added yesterday. So for the past 2 days, we've had at least 500 cases of COVID-19 reported among Mobile County residents. This is a number, a one-day number that is unprecedented, except for a few times where we had large spikes that were due to the backlog of labs. So again, this is our highest wave of, our largest wave of COVID transmission since we were affected by the COVID-19 epidemic a year ago in March 2020. 864 people have died, 4 deaths reported to us yesterday. We're on track to have twice the number of deaths in July than we saw in June. The cumulative number of people hospitalized with COVID-19 is at 6,296. 12 people were admitted to the hospital yesterday with COVID-19. Yesterday, 198 people were admitted or were in Mobile County hospitals with a COVID-19 diagnosis. So if you remember, the large number of hospitalizations that we saw in January was up in the 200s, and so we are quickly going to get there, it looks like, if something doesn't change very quickly to slow transmission. So that thing that needs to happen quickly is people need to mask when they're around others that don't live with them. Whether you're vaccinated or not, if you're indoors. People who are older, have underlying health conditions, whether you're vaccinated or not, you should wear a mask. Again, particularly if you're indoors and around people that may not be vaccinated, please consider wearing a mask and maintaining a distance of 6 feet or greater from people that don't live with you. And get vaccinated as soon as you can. It takes the minimum length of time it takes to get fully vaccinated is 2 weeks. So you can get a single dose of J&J vaccine and have the full measure of protection from that injection 2 weeks later. For the Pfizer vaccine, it will take you 5 weeks from first shot to fully protected, because you'll have to get a shot, wait 3 weeks, get a second shot, wait 2 weeks to get the full protection. During that time, you'll have some protection, but not the full measure of protection. And then for Moderna, it will take you 6 weeks to get fully protected. If you want to protect yourself from COVID and help us slow what has become our largest wave of COVID since March of 2020, we need you to implement protective measures to slow transmission. We just don't have enough people vaccinated to interrupt the human-to-human chain of transmission of the Delta variant. It is so highly infectious. It is just moving like wildfire through our community, and we don't have enough fire lines dug to stop the burn. So please protect yourself by layering on the prevention measures: vaccine, masking, distancing, staying at home if you're sick, covering your cough when you're in public, washing your hands, disinfecting surfaces. And if you are sick, stay at home. If you are exposed to someone with COVID, stay at home. Please help us stop transmission of COVID-19, or slow transmission of COVID-19 in the community. I'll ask we'll talk a little about a couple of more myths about the COVID vaccine that we haven't gotten around to. One is, can a COVID vaccine make me sick with COVID? No. None of the vaccines, the COVID-19 vaccines authorized in the United States, contain live virus that could cause COVID-19. So getting a COVID vaccine cannot make you sick with COVID. You may feel a little soreness in your arm. You may feel achy. You may even have a mild fever following vaccination, but that should go away within 48 hours. And those are just mild side effects of your immune system working hard in your body to build immunity from that vaccination. This is one I've just heard recently. Can being near someone who received a COVID vaccine affect my menstrual cycle, or can getting a COVID vaccine affect my menstrual cycle? No. Your menstrual cycle cannot be affected by being near someone who received a COVID vaccine. There are lots of things that can affect it, of course, like stress, changing in your schedule, problem with sleep, changes in diet or exercise, and infections may also cause. So if you got COVID, you may see some change, but receiving the vaccine or being around someone who received the vaccine is not going to interrupt or affect your menstrual cycle. All right, I wanted just to go over, just review briefly. The Centers for Disease Control published an official health advisory on COVID-19. This is not something I've seen them do in many, many, many months. And it basically is talking about vaccination to prevent COVID-19 outbreaks with current and emergent variants. We are seeing outbreaks all over the county in almost any type of setting. So the CDC is urgently making some recommendation and asking people to, particularly in lower vaccination areas like Mobile, to take some actions to try to prevent outbreaks or clusters or super spreader events. And some of those things, are, continuing to, if you're not fully vaccinated, carry on all the prevention measures that we talked about. If you're immunocompromised, do the things that you need to do to reduce your exposure and protect yourself, preferably with the vaccine. But again, if you've not been vaccinated and you have an immunocompromising condition, please talk with your healthcare provider about that. But there are almost no reasons to defer COVID vaccine except if you have a severe allergic reaction to any of the components. And again, we're just asking people to get vaccinated. We need people to layer on prevention measures. We need all clinicians to offer and recommend COVID vaccine to their patients and community members. We need all of our community partners making vaccine available so that they are easily accessible to unvaccinated populations. We need all of the businesses and schools and churches to revisit their infection prevention plans, revisit and think about implementing some of those controls that were lifted early in the summer. Things like, limiting the number of people that are, attending religious ceremonies in person, funerals, marriages, after-school parties, weekend parties, concerts. Just go back to those things that you had done that were very successful starting in February. Once we got over that December, January peak, we started coming down and we were implementing control measures, and then we started seeing vaccine in the older population, and we got COVID transmission down to a very low number in June, late May and June. We did a really good job. We know what to do to slow transmission. We've just got to re-implement those things to the greatest extent possible, and we have to do it on our own accord. No one's going to tell us to mask. No one's going to tell us to limit participation. So we have to do the things on our own that we know work to stop spread of COVID in the community. CDC made a really big change yesterday in saying that even if you're fully vaccinated, if you are in an area of substantial or high transmission, Mobile is substantial transmission. Almost all of Alabama, all of the Southeast is in high or substantial transmission. Sorry, I misspoke. Mobile is in a high transmission category. So in this situation right now, CDC is recommending that anyone in an indoor setting wear a mask. And as we've talked before, if you are fully vaccinated but you have a weakened immune system or underlying medical condition or something that puts you at increased risk of severe disease, you also should wear a mask, maybe even outside or anytime you're around people that don't live with you. So again, this was updated yesterday. If you're fully vaccinated, you can participate in many of the activities. They used to say all, now it's many. But to maximize protection from the Delta variant and prevent possibly spreading Delta variant to others, wear a mask indoors, in public, if you are in an area of substantial or high transmission. Mobile County is in high transmission category. So that coming from through a CDC Health Alert Network yesterday. All right, there are lots of questions here. It's going to be, I didn't get to review them all, Mark, so I'm going to give it my best shot. Couple of media questions. WKRG's ask, how is the Delta variant being tracked in Mobile County? How do we know it's on the rise if normal COVID testing does not show the variants? In April, the Mobile County Health Department initiated Sentinel Sequencing or Sentinel surveillance for COVID sequences in Mobile residents. We've been working with a local laboratory to identify and prioritize specimens for sequencing. Each week, between 20 and 70 specimens are sequenced to help us monitor the distribution of variants in Mobile County. When we started 3 months ago, the variants that we saw were all the UK variant. About 2 or 3 months ago, when we began picking up the first Delta variants, you see a nice but slow transition with the Delta variant outcompeting the UK variant and is now the majority of sequences that we look at weekly from Mobile County residents. This is again a project that was initiated and is being funded by the Mobile County Health Department using some of our COVID money. WALA is asking about a news report with new data suggesting vaccinated people could have higher levels of virus and infect others. Are we seeing that? There have been reports that the Delta variant may, once you're infected, may replicate faster in your respiratory system than other variants. And if you are vaccinated and young and healthy and you're infected with the Delta variant, it's quite possible that you could be infectious to others and not realize it. Again, that's part of the reason why we ask people to wear a mask, so that if you are unknowingly infectious, that you are not spreading that virus to other people, or at least are limiting your spread by a face covering. And WPMI is asking about vaccination numbers. The question is, it appears a high percentage of Dauphin Island residents are vaccinated. And why do I think that is true? Yeah, we have noticed that Dauphin Island has the highest vaccination coverage of any other zip code in Mobile County. They have been very engaged with watching trends in COVID transmission. They reach out to us frequently for collaboration and consultation. They have invited us several times, many times, to do vaccination on the island. You know, our highest vaccination rates are in the 65 and older age groups. So it may be that is the dominant demographic of the permanent residents on Dauphin Island. So yes, but remember that the high vaccination coverage is on Dauphin Island residents. So in the summer, when they have lots of tourism, then their true vaccination coverage goes down. Like I said, they have been very proactive in monitoring transmission and opening and closing public spaces based on the rate of transmission in the community. So I think those are the things that are contributing to heightened awareness, sponsoring vaccination clinics, and perhaps an older population there where we have most of the 65 and older people already vaccinated. All right, here's Facebook questions. Let's see. If you had COVID and you got a vaccine, the J&J vaccine, can you still contract the Delta strain? Yes, you can. You would be a very unlucky person, but we know that an infection, you have a limited amount of natural immunity from getting COVID. You have pretty good coverage when you get the J&J vaccine and 14 days have passed, but not 100%. So it is still possible for you to contract the Delta strain if you had COVID previously and you have had a vaccine. All right, with masks being proven not to block COVID unless it's an N95, what's the purpose of thin masks we have? Okay, remember, an N95 is intended to protect the wearer, right? N95s are to protect the person who's wearing the N95 so that virus particles can't get in to their mask where they could breathe it in. The face covering, which in order to wear an N95, you're supposed to have a medical evaluation, have an annual fit test, right? It's not you just pick one up and put it on and you have, you're adequately covered. There are some NIOSH, the OSHA, not NIOSH, the OSHA has some very clear requirements for people who are required to wear N95s for their work. So, but again, the N95 is to protect the wearer. The face covering, even we'd like for it to be a 2-ply face covering, right? So 2 layers of cloth or fabric. And that is intended to protect everybody else, right? The face covering can help protect you, but it's got holes on the sides and it holes on the top and the bottom. So it's mostly intended to keep your respiratory droplets from going out into the air. So a little bit of clarification for that. Can fully vaccinated people contract COVID over and over again like the unvaccinated? I don't know. I don't know if you get if you're fully vaccinated and get COVID, you should have a bit of a boost of immunity, but I don't know how much that will protect you. So I don't know if that will happen. I think in theory it can. And again, as transmission occurs from person to person, that's how the virus mutates and modifies its genetic material to become more aggressive and more infectious. If we don't do a better job stopping it, we're going to be dealing with more variants in this county and in the Southeast as we go along. Right now we're dealing with Delta, could be Zeta, some other Lambda, the Lambda variant that's coming. We just don't know. But until we get vaccine coverage up, we may continue to see variants. Once we're done with Delta, we could be vulnerable to another one if we don't get people vaccinated. ADPH, so the Alabama Department of Public Health said this morning that it confirms at least 3,000 breakthrough cases. That's a big discrepancy from 1,500. So I haven't seen those data. I hope that ADPH is very close to making these data public so that we will all know what data they have and how to interpret that. All right. Someone asking, since vaccine can lessen symptoms of COVID, can vaccinated people have it without knowing it and spreading? And yes, the answer is yes. You can be vaccinated, be infected, and potentially spread it without knowing it, but it happens rarely. Remember, getting COVID following, in fully vaccinated people is extremely rare. Let's see. So someone else asking about, should even vaccinated folks wear masks inside? Yes, we're saying that now. Since we are in a high category for transmission, or are we now looking at cycle after cycle of new COVID strains? If we don't get more of our people vaccinated, we could be looking at cycle after cycle. Why shouldn't vaccinated wear masks since they can still contract COVID and spread it? So yeah, we're now saying that when you're indoors or in a close setting with people, whether you're vaccinated or not, please wear a mask when your county is in a substantial or high level of transmission. So I think that's it. Okay. Alrighty. So let's say, gosh, we still got 2 days. So again, any questions that you submitted on Facebook today, we'll try to address tomorrow. That rhythm seems to work really well for us. And if you have not already, please get up from behind your computer, get off of your couch, get away from your desk, and go get vaccinated. Thanks, guys. We'll talk again tomorrow.